What's up guys, Dr. Jared here, and in this video I wanted to demonstrate my single best exercise for sciatic nerve pain relief. Honestly, I give this one to about 90% of patients that I treat in my physical therapy clinic, and they do exceptionally well with it. So if you have sciatica, that is pain that kind of originates here in your lower back or the back of your hip, and then travels down the back of your leg, pain or numbness or tingling that travels down the back of your leg, I hope you get some great relief from the exercise in this video. However, is it okay if I over-deliver? What I want to do is, after I show you this first exercise, I want to demonstrate a couple of additional exercises that most people respond really well to that are actually going to be a little more specific for your unique individual needs, for your unique individual pain. So be sure to check those out after this exercise. Again, I hope this helps. I hope you get some relief from it. Coming at you right now. This exercise is called nerve glides or nerve flossing, and you can think about it like this. The nerve basically goes from your lower back all the way down into your foot. Somewhere in the course of that nerve, it's getting pinched or irritated or stuck. What we want to do is stretch that nerve and kind of move it out of that area of irritation or that area where it's getting stuck so that you start to feel better. And this is how we do it. What I want you to do is lay down on your back, and what we're going to do is that affected leg, I want you to bend it up towards your chest and with your hands grab right behind your knee. Now in this position, I want you to just slowly extend your knee, so I'm slowly straightening my knee until we get a good stretch down the back of your leg. Now, depending on how acute your pain or depending on how severe your pain, you may not be able to go very high with this until you get that reproduction of those nerve symptoms. That's about where I want you to stop. I want you to go to the point where you feel like it's a good stretch, but you don't need to push it into pain. Nerves are very difficult to treat, especially when they're irritated, because little things set them off. So we want to try to avoid that. So again, you're just going to slowly extend your leg until you start to get some of that pain, and then return back down to that starting position. And honestly, on day one, I usually start patients with only about 5 repetitions of this, but then our goal is to increase. So if day 1 feels okay at 5, day 2 do 6, day 3 do 7, up to about 10 repetitions. Now, when we get to 10 reps, that's where I start to add ankle pumps to it, just as one more way that we can mobilize that nerve. And those look like this. You're gonna lay on your back, you're again gonna take it all the way up as high as you can, right where it starts to get uncomfortable, and then I'm going to pull my toes towards me. Again, that adds just one more stretch to that nerve. Pull those toes right towards me, and then point my toes up towards the ceiling. That was 1, so pull it towards you, and then point it up to the ceiling. That's 2. About 3 to 5 ankle pumps up here at the end of your range of motion with your knee, and then return back down to that starting position. So now we're gonna pull up, all the way up as high as you can, and then about 3 to 5 of these ankle pumps while we're up here, and then return back down to that starting position. As soon as 10 repetitions with the 3 to 5 ankle pumps becomes comfortable, what I would then do is progress up to about 15 and eventually even up to about 20 repetitions. And that is what those nerve glides look like. Now, it's important that I mention not all nerve pain, not all back pain, and not all sciatica is created equally. Depending on what your exact diagnosis is, I would treat it very differently. So again, I do have a few bonus exercises that I want to run through. And what I want to do is I'm going to show you 3 bonus exercises that are going to be good for 3 different diagnoses, 3 of the most common conditions of this sciatic nerve pain that I see in my clinic. We're going to talk about a bulged disc, we're going to talk about degenerative disc or stenosis, and then we're going to talk about piriformis pain. I'm going to show you one exercise that's going to help your sciatica for each one of those, but then I've also got videos for each one of those that are going to have entire routines of exercises that you can do to help yourself out of some of that pain. I'll link to that at the end of this video. So exercise number 1, or your first bonus exercise, is going to be for a herniated disc or for a bulged disc. These typically respond best to extension-based exercises. You can do that as follows. If you know you have a bulged disc or a herniated disc, lay down on your stomach with your elbows underneath your shoulders. In this position, what we can then do is prop up onto my elbows, kind of push yourself up a little bit higher to introduce more of an extension or a back bend into your spine, and then return back down to that starting position. About 10 repetitions of this is a good place to shoot for, is a good place to start. When that starts to become comfortable, what you can do is even push up onto your hands until we're up into this full back bend motion. Again, push up just as high as you can comfortably. Spend some time there, one day or about 10 to 20 repetitions at that height. And then eventually we want to get up to these full back bends, about 30 repetitions. So that's bonus exercise number 1, again, for those of you with a bulged disc. Bonus exercise number 2 is for those of you who have a degenerative disc or stenosis. We absolutely do not want to bend backwards with that problem because that's actually perpetuating that problem even further. We want to try to open up your spine, not close it down. This is what it looks like. What I want you to do is lay down on your back with your knees bent and then tip your pelvis forward. So right now I've got an arch underneath my back. So I'm just lifting my back up off of the table. But now the exercise, the motion that I want you to focus on is flattening your back down into the table. So we call this a posterior pelvic tilt. You're basically taking your pelvis and rocking it backwards, trying to flatten your spine down into the mat. You're gonna hold that for about 3 to 5 seconds, and then you're gonna return to that starting position. So just kind of lift your back a little bit up off of the floor, and then you're gonna flatten that right back down. Feel it right in these tummy muscles. I want these tummy muscles to engage while you're down in that position, and then come right back up. And about 3 sets of 10 repetitions is what I like to shoot for with this. Now, finally, bonus exercise number 3 is for those of you with piriformis pain. And honestly, with sciatic nerve problems, a lot of people are tight right through the back of that hip. That can be a symptom of your sciatica, or it can actually be the cause of your sciatica. And so either way, a lot of people get relief from a piriformis stretch. What I want you to do is lay down on your back. And again, if my pain were here on my left side, I'm gonna cross my left leg over my right. And now with my hands, I'm gonna grab right behind my right knee and then pull that right knee up towards my chest just until I get a good stretch right here through this left glute. Kind of deep in the left glute is where that piriformis is. It's a deep hip rotator, and we're just trying to stretch that out. Hold that in a comfortable position. You're gonna hold it for about 20 seconds, and then you're gonna repeat that 3 times. A lot of times people like to keep this one even. I have them stretch out both sides just because they like the way that that feels. Now let's see, again, I mentioned to you before, I've got some videos for each one of these specific unique problems. So if you have a disc bulge problem, here's the video I want you to click on. If it's a stenosis or degenerative disc problem, right here. If it's a piriformis problem, right here. You can subscribe to Tone and Tighten at the circle right here. Hope you found this helpful. We'll see you again soon.